Hi everyone, I'm Anthony So, Professor of the Practice and Director of the IDEA Initiative at the Johns Hopkins Bloomberg School of Public Health. This summer and fall, our team at React Action on Antibiotic Resistance is working with the International Federation of Medical Students Associations to host Innovate4AMR, an online competition aimed at improving antimicrobial stewardship in resource-limited healthcare settings. Why are we focusing on tackling antimicrobial resistance, or AMR? Antibiotics are the cornerstone of many miracles of modern-day medicine, from cancer chemotherapy to organ donation. The loss of effective antibiotics would mean reverting to a time when simple infections might become untreatable. Each year, 700,000 people die due to drug-resistant infections, and if unchecked, this number may rise to 10 million deaths a year by 2050, more than the number of people that die of cancer today. The economic toll could mount to $100 trillion by then, but along the way, the World Bank projects that AMR, if unabated, could push 24 million more people into poverty by 2030. Antibiotics should thus be considered a resource to be used with care, yet underuse, overuse, and misuse of antibiotics are prevalent in many settings, from hospitals and outpatient clinics to farms and food systems. This is why we need you. There remains an urgent need to develop innovative, scalable approaches to address the challenge of conserving existing antibiotics. This is an interdisciplinary challenge that will demand a response from everyone in society. However, healthcare professionals have an especially crucial role to play in bringing attention to the issue, both within the healthcare setting and within their communities, both local and global. Innovate4AMR seeks to engage student teams in designing innovative solutions on how antibiotics could be used more appropriately. How can we change the expectations patients have to receive antibiotics, even when their illness is viral and not treatable with such drugs? Can we change the incentives that prescribers have in responding to such requests, perhaps offering a kit that treats the symptoms of a cold or flu? How can we use today's technologies more strategically to address AMR? For example, what role might telehealth play in improving antimicrobial stewardship in hospitals, where there are no local infectious disease experts? Might mobile phones enable physicians to offer time-delayed prescriptions for patients where it might be best to watch how the illness unfolds for a couple of days before resorting to antibiotics? How should we ensure access but not excess of antibiotic use? Do we need a scorecard to track access to second-line antibiotics in resource-limited settings? Might such tools hold governments and healthcare delivery systems accountable to meet the needs for our most disadvantaged patients? Innovate4AMR seeks to engage student teams in designing innovative solutions on how antibiotics could be used more appropriately. No prior experience in working on AMR is necessary, as we will provide you with educational resources about the subject. Part of our mission is to help support the next generation of leaders. The competition finalists will be flown to Geneva, Switzerland to participate in a capacity-building workshop on AMR supported by WHO. There, the finalists will have the chance to present their projects to a set of experts and make connections with groups that could help them operationalize their project. The world needs your best solutions. We hope that you will take up the challenge of Innovate4AMR and help us change the course of antimicrobial resistance.